Welcome back to anatomy classes. Today we are going to learn about osteology of parietal bone. The parietal bone, which is a quadrilateral shaped bone, and gets ossified by membranous ossification. And what is important is the side determination of parietal bone. So to identify its side, whether it is right or left, so we have to see the outer surface is the smooth convex surface is the outer surface. So this is the outer surface, should be outer, and the inner surface is the concave surface, which is irregular in its inner surface. This is inner concave surface. And here is the anterior border and posterior border. And the other identification, which is anterior, which is posterior, see for these grooves. The grooves are for the middle meningeal vessels, and because of these grooves, if we trace the grooves, they converge from the anterior-inferior angle. The grooves converge from the anterior-inferior angle and diverge towards the postero-superior angle. So this is the anterior end of the parietal bone. This is the postero-superior part of the parietal bone. So here is the anterior. So this is how we hold it. So this is right parietal bone. And next identification feature is, on the posterior inferior angle there is a groove for the sigmoid sinus, which is called sigmoid sulcus. So this groove is present on the posterior inferior angle. And the anterior inferior angle is more prominent because it articulates with the sphenoid, so it is called as sphenoidal angle or sphenoidal process. And along the superior border, that is upper border, there is a groove for the sagittal sinus. Superior sagittal sinus is lodged in this sulcus. So superior sagittal sinus is present in this superior sagittal sulcus. And along the upper margins we can see for pits. These pits are for the arachnoid granulations. So the parietal bone is derived from Latin, the word from paris, from Latin word, which means the wall. The two parietal bones, there are two right and left parietal bones, and they form the major part of the wall of calvaria. That is the reason they are called as parietal bones. And if you see each parietal bone, it is a quadrilateral in shape, and here is the right side parietal bone showing the external aspect, and this is the internal aspect of parietal bone. The external aspect of the parietal bone is convex, having a prominence which is called as parietal tuber or parietal tuberosity, which is the highest convexity point. And it has got four borders: superior border, anterior border, posterior border and inferior border. The superior border articulates with the parietal bone on the opposite side. Anterior border is called as the frontal border because it articulates majorly with the frontal bone. And posterior border is called as the occipital border because it articulates with the occipital bone. And inferior border, which is called the squamous border, articulates mainly with the squamous part of the temporal bone, and it also articulates with the two other bones. Anteriorly it articulates with the greater wing of the sphenoid bone, and posteriorly it articulates with the mastoid part of the temporal bone. So these are about the borders. And parietal protuberance. Parietal protuberance is the prominent part of the parietal bone and where the ossification begins, and the ossification spreads like a spokes of a wheel from the parietal protuberance, leaving the angles of the parietal bones in ossification. So the angles are the last to ossify. So because of that, they leave gaps between the other bones called as fontanellas, and which ossify just after birth. And anterior fontanella is the largest among all, which closes 1.5 years after birth or 18 months after birth. And over the external surface, or identify two lines which are called superior temporal lines and inferior temporal lines. Superior temporal lines gives attachment to the temporal fascia, and inferior temporal line, below to that the depression is called temporal fossa, which gives origin to temporalis muscle. And there are every angles. This is the frontal angle, anterior-superiorly frontal angle, anterior-inferiorly the sphenoidal angle because it articulates with the greater wing of sphenoid, and posteriorly, inferiorly the mastoid angle because it articulates with the mastoid process of temporal bone, and posterior-superiorly it is called occipital angle as it articulates with the occipital bone. Let's see the inner aspect of the frontal. Inner aspect of the frontal is concave and it is mainly identified by these grooves. These grooves are meant for the grooves of middle meningeal vessels. So the middle meningeal vessels makes these grooves. So if we trace these grooves, they arise from the anterior inferior side and they diverge towards the posterior superior side. So by seeing these grooves we can identify which side the parietal bone belongs to. And along the superior border, that is the parietal border, there is a depression on the inner surface which is a groove sulcus called as superior sagittal, groove for superior sagittal sinus, and the sulcus is called as sagittal sulcus. Along the sagittal sulcus there are some irregular pits, deep pits, which are for the arachnoid granulations, and inner surface is irregular because it is related to sulci and gyri of brain. And inferior border near the posterior inferior angle of the inferior border, inner side, there is a internal aspect, there is a groove for the sigmoid sinus. So part of the sigmoid sinus is lodged in this groove. And the projection here antero-inferiorly is called sphenoidal angle, which is little prominent, which is also called sphenoidal process of bone gets ossified by membranous ossification, and ossification begins at the frontal protuberance and spreads in all directions, leaving the angles to ossify at last. Hope you like this session. Like, share, subscribe and press the bell button for further notifications.